Hi, Jenny here. Today is Monday, July 24th. Woo! It's been a while since I've done an update. Had my radiotherapy appointment on Friday. So, a lot went on. I mean, I kind of thought it would be a lot. And then as I thought about it afterwards, it was really a lot. I was thinking maybe I would do this video on Saturday. I was planning on trying to get a quick little the video in so I could get it up on my channel, inform you guys what's been going on. But I thought, well, I want to take some notes so I make sure that I don't miss anything, because there was a lot that went on and I was writing notes and writing notes and writing notes. Figured I would do this like when my husband goes grocery shopping and nobody's in the house, and I would film. I was still writing notes by the time he came back from the grocery store. Like, well, this isn't going to happen unless he kind of leaves again later or something, which he had to do another short trip later, but I just wasn't up for it. So obviously this is all something new again that's going to be happening, and trying to get my mind even just to process a little bit, just knowing again, one day at a time, because I know a Wednesday I was feeling it a little bit, and I'm just like, yeah, no. Thursday I felt a little more anxious and kind of was crying on and off, and then telling myself again, you know what, today's Thursday. Let's get through today and make today a good day. And tomorrow's Friday, and we'll learn what we need to learn. So before today's video, I thought, well, I will type up the notes. Again, making sure, it's like kind of what I'd written and stuff, so that I won't miss it. And it's one page double-sided and another page. So yeah, it was a lot. As per usual, asked my angels on Thursday night to be with me. In fact, probably again before I was asking them, I was crying in bed going, yeah, they were going to be there. They were going to, help me get through this. Friday, pretty much all the way up to the hospital, I was crying. Just because. Couldn't stop it, couldn't help it. I'm like, all right, the angels are nearby. I'm like, this is great. I really appreciate this, but I need to just kind of back off a little bit so I can stop crying, because I really didn't want to cry during the appointment. Asked to be able to just have an open mind and hear what was going to be said and take it all in and be able to understand it. So, we've been to this clinic before. We had our one radiotherapy meeting, but it was with a different doctor. Didn't care for her so much. She, in my opinion, didn't seem as knowledgeable and whatever going in. I had a good feeling going into this one, and meeting this doctor was great. He was awesome. So let me back up. Let's start. So again, we've been to this clinic. So we checked in, we waited. The one nurse brought us back, and it's one that I'm pretty sure we met her at the last visit, and she's talked to me on the phone a couple times and stuff. So got to talk with her again. She is just all very nice, and they're all very nice, but very nice and understanding. And took my weight. I was down a couple pounds. I was kind of surprised about that. So it's like, is it a different scale? Is it, I don't know. I was, kind of, I don't feel like I'm that far off. I feel like my body weight's kind of the same, but we'll see. I don't know how often they'll be taking my weight, because in reality it's supposed to be a quick process. So I'm kind of going to get there, get in, get out. So we shall see. So yeah, and she took my blood pressure and oxygen level, and that was pretty much about it. So then the doctor came in, and like I said, we met him, and again, it was just a very positive experience. It felt calm, it felt good, good vibes. He was very nice, he was very knowledgeable. He was like, so I read about your case before this, so it started, here, and you had this, and you had this, and he was a little off, but I mean, he knew the material, he knew what was going on with me. So then he proceeded to, well, actually he asked if we had seen the scans at all, the CT or MRI. And no. And he's like, really? Nobody's shown you that yet? I'm like, No, I thought I saw somewhere online that I could order my own copy, which would be pretty cool. I still might, just because I find that interesting. But so he turned off the lights in the room, pulled up the scans, showed us a CT scan, and well, I guess it was a top-down view for that one too. So it was very nice. I was gonna pull up a copy. Maybe I'll put a picture in of somewhere of an online scan of what you can see, because I could see my spine. I knew what that was, and then he's kind of like, well, the black areas are where air is. So those are the lungs. I could see up on top, and then at one point in the bowels there were some areas of little air pockets in your intestines, and I was like, okay. And then showed the liver and the spleen, and they were just gray blobs. It was just. Granted, I know the body's not colored like our cute little anatomy books are, but. Okay, so yeah, liver and spleen and kind of the bladder or something, and the intestines were just a blob of gray, and then he kind of was like moving little cursor or whatever, so it was kind of going in and out, deeper in or whatever, and he was like, and there's your tumor right there. I'm like, okay, where? He's like, yeah, right there. I'm going. It was a gray blob. So thank God there are people out there that can read these things, that know what they're doing, can tell the difference of tissue or what, I don't know. He pulled up the MRI, and I thought, okay, well, the MRI, maybe I'll be able to see it, because again, MRIs are supposed to be so much more in detail, and that's why you have to have the MRI along with CTs or whatever. Same. I could tell the spine. Everything else were just gray blobs, and like even with intestines, I thought I'd see a little bit more. I mean, yeah, it's gonna be gray, but I thought I might see a little outline of, because again, the intestines, wrap around, or even seeing, the large intestine, and it was just a gray blob. And same thing, tumor. I couldn't see it. So be it. Still kind of interesting to see, but. So then he he has a notepad there, and he wrote notes for me, which was very awesome, because he's like, yeah, I like to write notes for my patients, because again, so that you have it in writing in case you're not understanding, listening, paying attention. But so he wrote me a nice little page of notes, drew me a nice little diagram of the pelvis area and what it's supposed to look like. Had said that my tumor in the rectum area was kind of all around, which also would be interesting to clarify, because in the first CT scan, the wording that I saw regarding that, I thought it said it was like 4 centimeters by 9 centimeters, which to me is a ridge. It's a line, that's, as opposed to it's all over. So again, I'm trusting the process. I'm trusting this. They've done this for years. So he explained to me how the radiotherapy was going to work. My diagnosis is an adenocarcinoma of the rectum. Stage 3, my glasses on, what he wrote. I know I've seen this before. Oh, the goal. The goal of the treatments is cure of disease. And I have seen that since the very beginning. It was that basically this is curable. They don't have questions about it. They think, they're pretty positive they're curing me. And the 3 steps are the chemo, and then chemo and radiation, and then surgery. And so like I said, so yeah, that surgery, that is a for sure thing. And he was like, yeah. So just clarifying, because I'd heard that before, and I could just checking. And he said, yeah, he's been doing this for 37 years, and that back then there wasn't this combination of treatments. It was pretty much just like surgery, and that didn't cure people, and the survival rate was much lower. And now, with doing this 3-step process, you have a survival rate in the 80th percentile type of, 80% or so more. So that's good to know. I thought it was going to be higher than that, but that's a good rate. That's a good. So again, nice to know. He mentioned that the radiotherapy consists of basically the planning stage. So that's getting me set up for the CT scanner and how they know they're going to position me, so they'll be able to position me the exact same way every single week. The procedure, he was going to tape a BB inside my butt. I'm assuming kind of around the sphincter muscle. I thought he said, to the fact of that's where they wanted the radiation to stop, that it would kind of be just before that. So again, whether that gets in the way or list, they know that that's the base, that's the end point, and then they take that out. They just do that for this first CT scan here and all that, and then that comes out. And I need to have a full bladder, which I was kind of surprised about. I thought with my tumor being in the rectum area that it would be low enough that it wasn't going to affect my bladder, which should be up here somewhere. I know other people that have been going through the scans have had a tumor in their transverse colon. And obviously, yeah, that's near your bladder, and you don't want the bladder affected by the radiation, so you need to drink to get it. I thought mine would be low enough I wouldn't have to do that. No such luck. So yes, I do need to have a full bladder. I'll get into all that though. So as far as the tattoos, they have a way of doing it now at their facility that they don't do tattoos. They do some type of a laser light lineup somehow and do it that way. So that was interesting. That's okay. Treatments are going to last 15 to 30 minutes. And they're going to go for 5.5 weeks. So I know Dr. Paluski had thought that maybe 6 weeks. And I thought, okay, well, let's, leave it to the radiation department and see what they're thinking. Well, 28 days. So it is what it is. That's about it. The side effects are fatigue, which I'd heard about, diarrhea, and bladder irritation. Okay. I'd heard, basically you get maybe a sunburn down there, but I think the bladder irritation is something different, because somewhere else it also talked about that you may have to urinate more frequently as time goes on. But anyways, yeah, fatigue, diarrhea, and the bladder irritation. That was pretty much about it. I asked him about bone fissures, because that was something that I had read online, probably in one of the Facebook colon groups or something, and he looked confused. So like he hadn't heard of that at all, so that's good. So I asked him, like, should I be taking calcium, or like, can I take calcium? He's like, yeah, if you want to, sure, go ahead. But obviously he didn't know about any of that, so I ended up buying some calcium. I think calcium are, again, one of the bigger pills out there. So online I found some like chocolate chews that are calcium. So I'm going to try that. Can't hurt. Hopefully it'll help, and it's something chewable. I don't have to worry about swallowing. So that's that. That's about it. And then he said that he would see me every Tuesday. So basically it's just, I guess, a quick little check-in after the procedure's all done and everything and stuff. Then, then I see him to see how things are going. So very nice, because it is a treatment that, the treatments are Monday through Friday. So I don't think I mentioned that. It's 28 days, it's Monday through Friday, you get Saturday, Sunday off. But every Monday through Friday, you're going to go there until you get your 28 days done. So you're seeing them every day, so if anything is going on, you have any questions, you obviously can ask the staff. And then every Tuesday, he's also going to do a quick check and make sure that things are going all right. So that was about it with him. So that was good. Again, both Wayne and I felt really, really good about that appointment. We were very satisfied. So then, different nurse came in. So the CT nurse came in, and I don't know what to do at that point. I think I must have had a hair on me. I think I went to throw it away because I came back, and then I saw this water bottle on the counter by the, the nurse's computer type thing, by their room computer. And she was there, and I was thinking, oh, that's her water bottle. Okay, cool. And she goes, so for the CT scan, you need to drink this bottle of contrast and in 10 minutes. And it was a good honkin' regular supposedly 24-ounce water bottle. I think there was a little more in there. Yeah, I'm like, really? I had asked twice when they were calling the house. I guess not that it really matters. When they called and when they were setting up the appointment, and they called again about something and something about the appointment, I asked both times, am I going to have to drink contrast? Am I getting an IV, dye-in or anything? Oh, no. Nope, you're not going to have that. I'm like, okay, cool. Thinking, I don't really believe it, because I thought you kind of had to have some type of contrast to be able to see stuff in the body, but all right, maybe they can do, I don't know what other kind of CT scans they do. So no, I was supposed to drink contrast. For me, knowing my body, I can't drink that much. I don't drink that much. That whole water bottle, that is like something I drink in a day. Now granted, I've gotten better since I've gotten the ileostomy. I've been trying to drink more fluids, because again, even with the ostomy bag, the biggest side effect is diarrhea. Now I try to pay attention to all that as far as my body goes and all that too, because I have more liquid, say at daytime, nighttime, like overnight to the morning, it's usually more liquidy. As I eat during the day or whatever, it becomes more mush, like applesauce. And then it may get watery again, and then it gets mushy again, and then, so it's kind of like this all day long anyways. Some days I have more water stuff, like on Fridays after a pump removal or shot, it'll be like water, 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 water. Even though I'm thinking, okay, what's my list of foods that I can eat and try to help mush this up, type of thing. So we shall see. So in any case, and then because of that, when you're losing more fluids and stuff, because the small intestine doesn't absorb fluids as much, it's the large intestine's job to do that. Well, and my large intestine is like cut off, so cut off from having the nutrients. So yeah, it doesn't have as much time to absorb the liquid, so the liquid, is coming out. So you lose electrolytes, so I've been drinking more electrolytes. So I mentioned before that we've gotten the liquid IV. Comes in multiple different flavors. So this weekend, in fact, I think I ordered three more packets. We have cherry and grape and pina colada, which tastes very much like coconut. Which is kind of okay. I thought I liked drinking pina coladas, and I'm like, well, I don't know. But in any case, trying to find something like that works for me. So obviously with this, it was contrast, it was in water, it tasted metallic-y. She was like, yeah, don't drink through the little, you could keep this water bottle. I'm like, no. But don't drink through the pop-up top, because it may pour out the sides, because it doesn't seal the greatest, or this or that, whatever. Or I don't know, maybe they feel that's what they tell people, because it's easier to drink when it's caps off. I don't know. And then she said, and then after this, for each appointment, I need to drink, they wanted a baseline. They wanted to try to get the 24 ounces in and see where I was at. But they wanted me to drink like at least that much within half an hour of my appointment. Because supposedly you drink in the 10 minutes and then it takes 20 minutes to get to the bladder. So the good and the bad about all that is that is that part of my notes right now or not? Well, we're talking about it now. Yeah, so after this I can drink whatever. It doesn't have to be water. It can be any type of a liquid, but to try to get that 24 ounces in. So that'll be better, because flavored water for me, at least I can get down a little bit easier. Like Ensure drinks, I can drink in, a little 8-ounce bottle I can drink in 2 minutes. So we'll see how it goes. After I'm like, well, what if I can't drink the whole thing? Because the last CT scan I had, they gave me 2 like 8-ounce water bottles filled with stuff. And there too, I started crying, and I'm like, because at that time I really had no clue. And they're like, yeah, you have to drink this and all that. I'm like, she says, just do the best you can. It's okay. We'll figure it out. We'll do it. So I basically got down 1 bottle's worth, and she's like, that's all right. Okay, let's do this. So I'm like, okay. She was so super kind. So this nurse was all like, I'm like, what if I can't drink the whole thing? And she's like, just do your best. And she left. And then the first nurse kind of came back in. And in the meantime, I kind of just started crying. Again, the tears were just running. And I'm like, okay, I mean, be the good girl that I am, do my best. I'll try to get it all down. But so I was drinking, and the other nurse was explaining things, and I could tell at one point, I'm like, I'm not even paying attention to what you're saying, because I'm just stressed out about having to drink this liquid. But I thought, whatever, I got lots of paper handouts. I'm sure whatever she's talking about is in there. Andrew Wayne was there so he could understand. She felt bad. She kept patting my shoulder. She was just like, it's okay. She said, oh my God, I feel so bad for you. I'm like, so, because I would drink a little too, and I'd just be like, it tasted bad. It smelled like the plastic, or it was, they're like kind of metallic-y, but I'm like, kind of metallic-y, but more like well-water and plastic, which is just not for me. But I did my best. So, oh, and the other nurse too had also told me that today was like the day to be ultra picky as far as my setup. Wants to get me in the CT room, and I know they said something before. I thought they did a hip mold type thing that she said I was told they did a mold. I thought she said a hip mold. Maybe she didn't. But there's a mold that they make that then when you come in every time, they have that mold ready for you so that you're always in the exact same position every single time. So, she was like, so today just, be picky and whatever. I'm like, okay, cool, whatever. So, whatever. She left. Okay, the other nurse came in, gave me some more paperwork. So more about the radiation. So the another handout type sheet, pretty much just one page, that a few more side effects that this one mentions is the sunburn. You'll get like a sunburn, like what looks like a sunburn, feels like a sunburn in the area of the radiation. Your skin may darken. I've also heard other people say like they've gotten spots on their body and faces and whatever all over. Increased urge to urinate, which would be great towards the end of all this, but maybe I won't have it. Just I gotta put it out there. It's all gonna be okay. Burning or pain when urinating, and whoops. Oh, back at this one. And then hair loss in that area. So they want you to keep hydrated. So, and use Imodium AD, because again, with one of the other symptoms I mentioned before, like the fatigue, the diarrhea, and the bladder irritation, to use the Imodium. If you're having a lot of liquid output, they really do want you, because right now I'm like, whatever, I don't really need it, I'm home, it doesn't matter. But now to really use the Imodium if I'm going to need it. So she also gave me, I think that was it as far as what was all listed in there. So she talked about, again, because of some of these side effects and all that, I got a whole little bag of goodies to come take home with me. So there's a little pamphlet about colon, rectum, and anus radiation therapy for the cancers of that area. So again, just a little information about how that's all going to go. It gave me a little sitz bath. So like whether, you know, sometimes when you're feeling sore and irritated down in that area, that it feels really good to sit in some water. There's even a whole little IV system thing. She goes, I don't know if anybody uses this, but so you can put warm water in here. So if this water's cooling off, then somehow you open up the clamp on. Open up the little clamp on here and let some more water drain in your little bucket. She was like, if you can, just go in the bathtub, because that's a lot easier. I asked if I could use Epsom salts, and she said yes, that would be fine. They also provide these tablets for rash relief, so she gave me a couple of those, said if I run out of them, let them know, they'll have more. This is all free, that's all included. So that's really nice that I can ask her for some. I don't have to go to the pharmacy. I also have a little spray bottle. Is that one open? So same, even just regular going to the bathroom. If it's kind of getting sore down there and it hurts to wipe and stuff, that was kind of like a handheld bidet. You don't have a bidet in my butt. So if you have fill this with warm water, and then you just squirt it on your privates and clean it all up that way. So there's that. There is intensive skin therapy. This is lotion, basically to put on the skin areas. So either whatever on the buttock skin and or you know the top of my body or whatever, that if I feel I'm getting sore or anything, that this should be able to help take away that. And intensive skin therapy, which, oh, this is some cleanser. If I want some more gentle soap, again, to squirt this on myself and just kind of pat the area, and I'll then just try not to do a lot of wiping. So that should help. And again, and all that, if I use it and it works, and I let them know, and they'll get me more. And if it doesn't work, to let them know, and they'll see if they have anything else they can give me, you know, try to find something to help with that. So that's very nice, and very appreciative of that. So that's about it with that, yep. And then the other stuff of don't expose your areas to the wind or sun, or intense like hot or cold, like heating pads or ice packs, or she's like, it's kind of easy for that area, that you know, to me that's usually pretty, I always cover. She goes, so no nude beaches. Wayne was like, oh darn. No nude beaches for, I'm like, yeah, okay. So anyways, that was all right. And again, then she was, the other nurse kind of like checking back in, and Wayne's like, it's been 20 minutes. And I'm like, oh, I still hadn't finished. She's like, okay, now you need to chug the rest of that. And I still had a good, at least 6 ounces in there. And I'm like, oh my God. And she could see the tears going, and she goes, are you nauseous? Are you, and I'm like, no, I'm just getting full. She goes, well, get a couple more and sit down, see what you can do. So I did. I took a couple more glugs, and again, I was full. I was full up to here. I'm like, even though I didn't really feel like I had to pee, or I didn't really feel like puking yet, but I'm like, I was full. Starting to get that bloated feeling that I normally get. And so she was like, all right, let's go. So she took me to the dressing room, had me, well, actually before that she showed me where the dressing room was. In the meantime, because of drinking all that, and again, whatever, like my ostomy bag was half full. So I'm like, can I empty this? Because I don't want to go in the CT machine and have a full bag, you know, either. So that was just don't pee. I'm like, I know. So I went, you know, was able to empty the bag and not pee. Got all that set. Then I was in the dressing room, so basically take off everything waist down. Didn't matter that I was wearing jewelry, nail polish, any of that. I could keep my other stuff on. Basically pants and underwear. So you can keep your socks and shoes on if you want. And I thought, well, I left my socks on. I don't feel like having my shoes on. That'd be uncomfortable. But took me into the CT room, took a picture of my face. She's like, oh, we do this with all the patients. Just want to make sure we always double check before we do a procedure that we actually have the right person. And oh my, she'd given me a tissue when I first got in the room so I could dry my tears. Just like, okay, I'm gonna take a picture of you. I'm like, oh my God. I'm like, yeah, because I look so great. I'm like, all right, whatever. Took a picture of me. Then had me sit on the table, lay down, explain that what was under my feet was kind of, it looked like a bunch of styrofoam balls in, you know, in like a pool raft type thing. It was all flat, and it was also, and I laid down and I didn't really feel it. Didn't feel any different even on the table or anything. I'm like, I'm just laying there, and then they're kind of doing their thing of looking around or making sure I was positioned right or doing, and not saying, whereas the last CT scan I had, the gal asked, are you comfortable? Do you need anything? Is that a good position for you? Do you want a wedge under your head? Do you want, you know, are your knees okay? Type of this and that. So I, thank God, again, had been through that procedure and knew there are things I could ask for. So with this nurse going, today's the day to be picky, but yet she didn't even offer me anything up when I'm laying on the table. So I was like, I'm like, could I have a chance to have a wedge or something under my head? Oh, yeah. Okay, got that. Put that on my, and can I have something under my knees? And then I go, yeah. So they put some pillow thing or whatever under my knees. So I'm like, okay, that's good. Then, you know, I'm comfortable if I, again, have to lay there. And then they mentioned something about with what was around my legs or whatever. They're like, okay, this is some jelly foam something or other, and we're going to blow air in here, and it's going to mold around your legs. I'm like, okay. So I could feel it filling up, and I could feel stuff going along either side of my leg. That was fine. Then the doctor came in, and I had to bring my feet up, and I was so he could put the little tape BB, put the BB, and think I didn't hurt. He was like, it's not gonna hurt, it's not gonna hurt. And I'm thinking, oh my God, sticking up my butt. I'm like, that's where it hurts. But he put the BB in, and I'm like, I hope I don't pee on you or anything. He goes, you can pee on me, poop on me, anything, I don't care. I got gloves on. I'm like, oh, okay. Oh yeah, it's so nice. So he taped a little BB in there, whatever, got my legs back down in the position that they were at. They like have Velcro strap me in so they don't move. Took some pictures again of what the setup is. So again, every single time you go in, you're going to be in that setup. And then they did some type of a laser aligning. So there were no tattoos, which I was surprised about, but this facility has the way, whatever, I don't know. I could see like red lines, red laser shooting, and I don't know what's lining up on the table or whatever, but it knew where I was or how I was lined up. So that was okay. And then she had me put, they put some type of, I think the one gal mentioned a pillowcase. They put a pillowcase across my privates, and put my gown up a little bit, put that on there. Taped my bag up, so that was kind of out of the way. Had me hold on to some blue rubber ring on top so that my hands would stay out of the way. And that was it. Then they did their little CT scan. And that took about 10-15 minutes. So it wasn't too bad. I was feeling okay. And then afterwards, when we were all done, I think she took a couple more pictures. And then helped me sit up, which I thought, oh, that was very nice too, from a big old laying position on this hard surface. And I'm like, oh, how am I gonna? So I was able to sit up and felt a little pressure, not bad, thank goodness. I was like, okay, I'm good. And she was like, all right, and then kind of sent me on my way so I could get to the bathroom and then get dressed. So after the bathroom, then she handed me some paperwork. Oh yeah, that's right. She took the BB out. The BB wasn't going to stay in and all that too. So yeah, after the scan was all done, she took the BB out, and then, yeah, and then I was good to go. So I got out of the bathroom. She handed me some paperwork. So again, they have this big sheet of do not urinate. Make sure all over. It's like, yeah, follow instructions. Drink water 30 minutes prior. Do not urinate prior to your radiation treatment. After treatment, you may urinate. So and making sure you're there at the appointment. Because of so many people being there, well, obviously the other people are for radiation, so you don't even need to check into the front desk. When you come in, you be there on time, because they try to run 15 minutes ahead of time, actually, because they know people have full bladders and need to go. So again, that is very nice. If that's how it's going to work, that'll be great. So they're like, so your appointment time is your appointment time. You need to be in that waiting room ready to go. We can come get you. Boom. So like my very first appointment is next week Monday, actually at noon. So to make sure that I have it at noon, it's like noon, they're ready to go. They should be even coming to get me at noon, and then take me back and get my procedure done, and then I'm done and good to go. So she had everything scheduled out. I asked for having an earlier appointment than later, just in case, because it is for 28 days and it's all Monday through Friday. I'm going to try to drive myself to as many of these appointments as possible. Wayne doesn't want to take off that much time of work. He will here and there, like maybe for the doctor's appointment type things. Although even those, if it's just a quick, hey, how you doing? Everything going okay? Do we need, he doesn't really need to be there for that either. But again, from what I've seen from other people that have gone through this, and as the time goes on, you may get more fatigued. Well, the doctor did mention, he's got people that work full time going through all this. So, if they're able to do that and everything, and so we'll see how I feel, how this is all going to affect me and all that, and if I'll be able to drive myself. So we're hoping for an earlier appointment, so again, kind of get it out of the way, get in the morning, get it done, come home, and then he could go into work after that, if he needs to drive me. So for now, we'll see. I think he's going to take me to the first one, again, just so we see how it all goes, how it works, how I feel, and then we'll go from there. So she knew that this week or next week, as I do my first appointments, that the morning appointments were fairly full. But after that, that was somebody else's last week of treatment, and so that a couple spots should open up on the following weeks. So she did. So that first week is pretty much, I think, noon appointments. And then I'm kind of out. I'm like 8:15, 8:45. Yeah, and one day, because I have an appointment at St. Luke's at 9, they actually have me in at 7:30. So I'm like, ooh, okay. Because it's pretty much a half an hour drive to get up where I'm going. So say part of it is okay, I can start drinking my water right before I leave, or I'm like, well, once I get in the car, set a timer on my phone for 10 minutes, and because it's a half an hour drive, and also I'm probably going to try to get there early, obviously, because I need to be in the room and ready at that point in time. So I'll drink in the car and all that. And again, like I said, putting the electrolytes in the water, that helps, and I can get that down quicker. And I'll drink what I can, probably closer to that 20 ounces, and hope that goes okay. So part of my anxiety or nervousness about all that part is, again, I know my body. I know that when I even drink a little bit, I'm like, my bladder doesn't hold a lot. So I don't mean bonus. Maybe my bladder will get stronger during all this, even though it's gonna be irradiated, and supposedly I might have some more problems. So you have incontinence type problems. Got to put it out there again that all this is going to go well. It's going to go fine. I'm not going to have a lot of the side effects, or very minimal side effects. When we were traveling to Oshkosh or Platteville to visit our daughters, if I had a little inkling that I had to go to the bathroom, I told Wayne right away. It's like, if I just thought think I might have to go, I'm like, okay, we need the next exit, because by the time we found that next exit that had, whether it was a rest stop or the gas station or a grocery store one time, something right off the expressway, because a lot of it too is kind of boonies, but we'd find I had to pee so badly I didn't know if I was going to pee myself. That it was just I could barely move my legs. And then one time when we got to the grocery store, I was like, oh my god, oh my god, oh my god. I made it, but for every trip I brought an extra change of clothes, because you never know. So that's my nervousness about this, is having to drink so much and have to hold it. It's because even if I have to pee, I cannot stop my pee once it starts. I've tried. I know years ago, a couple years ago, that they even said that's another one of those help your pelvic floor muscles, or, you know, keep everything strong, and just for the heck of it, while you're peeing here and there, you know, try to stop it, because that's like a good exercise and all that. And I tried, and I've tried on and off, and once I can't stop it. So, granted, I'm sure they've had accidents there. I'm sure they've dealt with things, but I mean, how embarrassing. I'm embarrassed for them to have to clean up something. I'm embarrassed for myself if this is going to happen. If I'm going to go peeing on their floor, and then we're peeing all the way to the bathroom or something. Yeah. I don't want that to happen. And if you get a little bit more incontinent per se as time goes on, you know, so again, if I can find that sweet spot of how much I have to drink, that's not too much, that'll be just enough to get to, because they say too, it's like if your bladder's not full enough, they'll send you back out to the waiting room and have you drink more. So we'll see how this goes. Obviously, again, as the procedure is going on, I'll be more comfortable in knowing what's happening, how I feel, how this works and goes. And like I said, if I find enough to drink that I'll be okay with, that'll be the big thing. So prayers for that, please, prayers. That, the drink, you know, you gotta think about all the fatigue, the nausea. I'm kind of nervous about the nausea, this and that. You know, I'm more nervous about having to drink so much fluid. So yes. Obviously prayers appreciated through the whole thing, but I mean, really, let's, you know, prayers for my bladder holding out. Thank you. So, yeah, like I said, I think I ended up, where am I at? If I drank my 20 ounces, got me up, got my schedule. So we'll see how that all goes. So that was that part of the training all done. And then we went back out to the waiting room, kind of like checked in again, because I was also supposed to have my capecitabine training, which are the chemo pills. Another name for that is Xeloda. So when you come into this building, it's a one-story, well, I don't know, they may have a basement. I don't know that part. It is one story, and you have the radiation type part seems on one side, and I think maybe the doctor's offices type thing or whatever, maybe on the other side, because I checked in for doing the other training type stuff, and I ended up getting called back on that side. And this nurse also works for Dr. Paluski, so he works both out of the clinic that I've gone to on Good Hope, and he works up at Grafton. And so this is one of his nurses, and she did this training for these chemo pills. So again, besides all the radiation, it can't be easy. It can't just be like one thing. Even with my chemo, just one thing no. I have to take chemo pills while also going through radiation. So this is oral chemo, so it's not the IV type stuff, not whatever. You know, with IV, I also got a bag of anti-nausea. So with this stuff, I'd asked about, I'm like, do I get anti-nausea pills with this? Is that a thing? Again, other videos I've seen them have their little either cup of pills that they're getting, even, I think they're even for IV. So I don't even know what was all in there. I know a couple of them mentioned at home or whatever, there were some pills they had to take. So maybe that was even different stuff from when they were at the office. But even at home, they had to take some pills. And they mentioned those, and they come in kind of a, I don't know what you call them, like a sealed packet. So they had to like pop out the pills. Pills are, the amount of pills are based on your weight. So it looks like I think I'm getting 2 pills. 2 pills in the morning, 2 pills at night. I'm supposed to take them the same time every day. Ooh, that's right, I forgot I'm taking nighttime. I kept thinking it was only morning. Nurse took us back in the office, and again, had lots of paperwork for us to sign. I kind of figured, I'm like, at least with the IV chemo, we had a lot of paperwork and had to sign off on that. Yes, we agree. So, again, I talked to her on the phone before and all that stuff, and she was really good. So gave us a little, packet on on the chemo pills and what that's all about. She's like, I go over stuff, you could just read it. I'm like, let's see, 1, 2, 3, 2, 4, 5 pages. So first page is really just kind of about the drug and the side effects. So side effects of this one: nausea, fatigue, diarrhea. Woo! Just like with radiation. So again, it's kind of a double dose that I get side effects from both of these things, which obviously may increase the chances of that. I can also be more at risk for infection because red blood cells and white blood cells could be lower, and it could get skin inflammation. I've heard people talk about that they may get redness on their hands. Their hands would hurt. And then there's this thing called hand-foot syndrome. Now I know I've heard of that for, like daycare kids. Actually, I thought it was even hand, foot, mouth. Because again, other stuff I've heard from other people, sometimes they get mouth sores. So, but this one they're just calling hand-foot syndrome. So the palms of your hands and the soles of your feet may tingle, become numb, painful, swollen, or red. So again, I asked if I'm going to have hand tingles with any of this, the finger tingles, this and that. No, you shouldn't have that. Except the side effect, if you get the hand-foot syndrome, is tingles of the fingers. So, again, hopefully I won't. I don't know how often kind of people get that type of thing. Again, I know with the pills, a hand, foot. Yeah, hand. Gotta get a whole handout even on hand-foot syndrome. So symptoms include the redness, you're looking like sunburn, tenderness, possibly cracking or peeling of the skin. So yeah, I've had people talk about that too, where they've had cracking. So they usually have some creams and that they can prescribe and do all that. I had asked about mouth sores because I've again heard other people may have mouth sores. They've used a special mouthwash that that helps with the mouth sores. Again, you can't use just regular mouthwash because it has alcohol in there, and so that could just burn. Obviously, open sores and stuff that would just hurt. So they have a special mouthwash. I asked, like, I've also heard like baking soda and water. Oh yeah, you can do that too. But it also seemed to be something that she really hadn't heard of, is of people getting mouth sores. Interesting. She didn't even know the size of the pills. When I asked about, can I take this with food? Like, can I take it with applesauce? Because again, I don't particularly know the size. Again, what I've seen online, it's kind of like a little round, not that big of a pill. Like a, I don't know, does Bear aspirin even come round or something? Bigger than an Advil, but more a white pill that's more flat but round. So that I should be okay to swallow those, because again, as the pills are bigger, as I said, with the like potassium type pills and whatever, I have to cut those in half. They mentioned with these pills, like, not to cut them in half if that is needed, like the pharmacist has to do that, but I think that's just more of a house precaution type thing. But so being able to take it with applesauce will be a great help. So that'll be good. It does say take within 30 minutes of a meal. So that too, it's all kind of like people, she's like, well, yeah, it says take within 30 minutes. So they want you to take it with food. It doesn't specifically say take with food, as prescriptions usually do. I don't know why, this is just take within 30 minutes. Yeah, I would think again, because these are toxic pills. Like I said, they come in like a little zip back thing. You have to pop out the pills. I know one person mentioned that he popped them out into a little like pill cup. Somehow he was given a bunch of those or something too, that so he wouldn't touch them, because you get blisters on your hands even just from touching them. A different person I saw took them. She was like, oh, she just put them in her hands and popped them in her mouth. Like 4 pills, took it with water. Even he took his with water, and I was like, holy cow. You could do. She was like, yeah, people are surprised that I can take these pills with it. And I'm like, yeah, not me. So then they say, but if you put them in your hand and take them type of thing, and even have to take it, like, to wash your hands. So this nurse explained, to the fact of, and what's in the paperwork is that I'm exposed to the chemotherapy. I'm exposed to all this. It's in my body, supposed to, whatever. It's already there. So if I touch the pills and I do it, that's fine. But if I like touch the sink or whatever to try to not use like the part of my hand the pills were at or whatever, so that I don't get it on the sink, so that if another family member goes and touches the sink, the part where I touched or something, then it doesn't affect them. Because supposedly it could give them either a headache or diarrhea or blisters on the skin or sensitivity anyway, whatever. But so these pills are toxic. It's kind of like, again, it's medicine. It's going to do what it needs to do. Everything is going to be okay. It's going to go and affect the area that it needs to and take care of everything. It's all going to be okay. So again, the pills should be okay. If I have leftover pills, first of all, the pills you can't even get at the pharmacy. It comes from a special company. We have to order them specifically from there, and they get sent to the house. That which is something about like, I don't know how fast they expire, but they're like, they'll be fresh pills. They'll be okay. So I'm getting, because I only have the 28 doses. I think they ordered 30 just to make it easier. And so they're having, they'll have 30 doses sent to the house. So if there are leftover pills, as they say too, you can't just drop them at the pharmacy. I'm getting 30-day supply, so I should be getting 60 pills. 30, 60, 120 pills, because I get 2 in the morning, 2 at night. I can do math. In any case, if there are leftover pills, you have to call the pharmacy and see if they'll take them back. And the company may or may not send, there's a special bag to put them in, like, the different pharmacies and the police stations have drop boxes for if you have leftover medications that you're not taking. Because obviously you shouldn't be flushing them in the water and affecting our water systems and lakes and whatever, and they don't want you throwing them away, getting them in the landfills again, which could leach into the water systems. And I don't know what they do with them in the end, but in any case, you get a special black bag. So either, like I said, maybe one sent with the pills. Otherwise, you have to ask the pharmacy, like I said, if they take that type of pill, and they should have a black bag that you put these type of pills in. And then you can put them in their drop box, that they can take care of that. So that's that. They did also prescribe anti-nausea pills. Thank goodness. So they're like take as needed. So I thought that was interesting too, that it's not an absolute. It's not that I take anti-nausea pills each time I'm taking the chemo pills. It may end up that way, but so that's through the regular pharmacy, so I've got those to pick up. Different than the 2 pills that I was prescribed before. And again, seeing how these work. As I said, if these don't work, they can prescribe a different type of anti-nausea pill for me. And that's kind of like a take every 6 hours as needed type of thing. So at least, again, I will have that at my disposal that I can take if needed. So that'll be good. What else? Anti-nausea, chemotherapy. Oh, so then I also have this, and the chemotherapy safety sheet. I don't remember getting one of these with the other guy. I read all that paperwork I got with my other cancer stuff. Because then again, people online have talked about, as far as if you're having sex, that you need to use a condom for protection for both parties, depending on, it doesn't matter who's getting the chemo. That there's that. None of those kind of worries here in this house, because that's not happening with where my tumor is and what things are going on. So I know that was a thing. Obviously talk about liquid. Well, this one all explains that, yes, you're going to have chemo in your bodily fluids. So in your saliva and your urine and your stool and your vomit and sweat and tears and but yet you can have, I find this funny because it says to make sure people are wearing gloves if they're going to be touching any of your fluids. But As part of your cancer treatment plan, you may need chemotherapy. During this, you're given strong medicines to kill the cancer cells. These medicines can stay in your body for up to 72 hours. During this time, they may be in your fluids. It can be harmful if it touches the skin, so you need to make sure caregivers and others close to you are not exposed to your body fluids during chemo and for a few days after. But it's okay to have normal contact with other people, including hugging and kissing. Like, okay. It's in your tears, it's in your saliva, but go ahead. You can still hug and kiss. Which, whatever. Yeah, that's the one thing that, Wayne and I will still kiss all day long. It hasn't been a problem for, again, obviously they could then have some side effects. So, I found that interesting. And again, talking about going to the bathroom, and I'd heard this from a cousin who was going through like radiation, or and then about go to the bathroom, make sure you close the toilet when you flush twice. I'm like, oh, all right, I don't really need that either, but I'm pretty much the only one who uses the downstairs toilet here. I go upstairs in the middle of the night, but the other two more use that, so whatever. I don't leave a mess. It's obviously for leaving a mess on the toilet, or to clean up after yourself type of each time, or yeah. And or obviously when cleaning the toilets, just to be careful. And laundry, if you have any type of fluids on, whatever, sheets, towels, and all that, to try to wash those separately from other laundry. That's about it with that. And it's like, oh, alrighty. It doesn't. I asked about whether I can still do acupuncture, because again, I know that was offered up at the beginning. I haven't looked really into it yet in that, but they said, yeah, that should be fine. And then with my port, because it's not really going to be accessed for any of this, I guess I am getting blood work 1 week out, just to see how everything is going and affecting my body. But otherwise, she said that the port can go about 3 months without having to be used or flushed. Because then I'm like, do I have to go somewhere every like 2 weeks and just have it flushed out and, just keep it going and clean? And she's like, nope, it should be good unless you've had complications before. And again, I have not. Thank you for all your prayers. I have not had any complications, so I should be good. So that was kind of that whole appointment-y stuff. So yeah, got in the car, and it was just kind of like a little overwhelmed. I mean, I knew it was going to be a lot of information, and it was a lot, and it was expected to have a lot of information. So it wasn't totally overwhelming. It was just a little overwhelming. Of knowing this, and again, I'm sure it was more the anxiety of having to drink fluids. So again, it's just like, you know what, it's going to be okay. We'll figure it out. Day by day, let's just get through it. Let's start the procedure, and we'll know how it's going to go. So that's true. Even still, here and there, just thinking about things of all that is human nature. I cried on and off all day Friday, pretty much probably a little bit on Saturday. That's probably about it. I think Sunday I was okay. Maybe towards the end of the day if I thought about it, but yeah, just again, phase 2, new learning experience. So other than that, as far as other life stuff, finally started feeling myself again on Thursday. That kind of happened after the last treatment too, where it took until Thursday to feel like, oh, I'm finally normal. I finally have the energy. I can do stuff. I can. So it was okay. But Friday it was Saturday. And Friday I was probably pretty good. Saturday was so good. I was barefoot. I was in the kitchen. I was doing dishes, and I didn't think until afterwards. I'm like, oh, I'm not having any tingles in my feet or up my calves. That was pretty awesome. And then I sat at the computer, and while sitting there, sometimes my hands get cold, and then they start to tingle and all that. Didn't have any of that. So I'm like, yay, okay. So if some of that's going away, we shall see. Last night and today I had some other symptom thing kind of showing up. I don't know what it is. It's just weird, hard to explain. I was in the bathroom getting ready to brush my teeth, but sometimes what I do is, because my hair is not falling out, but it's thinning, I had my hair up in a ponytail, so I took it down. Then part of it was I wanted to get rid of some of the loose hairs so I didn't get them in bed. So I always just run my fingers through my hair and then throw the loose hairs away. And then, like towards the end when I was doing that, I was feeling kind of like if you rock on your feet, maybe how you feel, but I was feeling a little like zing across the top of the middle of my foot. And it kind of went almost from like the middle of the calf and down. And I'm like, well, what the heck is this? But it was more in the foot. And I'm like, okay, it's not a cramp. It's not a muscle twitch. It's not, I'm like, well, stop that. So I think I tried like raising one foot up. I think I had one flat. I did one, I was kind of on my toes and trying that and do whatever. And I still kind of, I'm like, okay, I think I was kind of done with what I'm doing. I'm going to just go lay down and, get in bed and go to sleep. And then today I've had that on and off, just sitting at the computer. So even I'm just sitting and all of a sudden I'll feel a little zing in my foot. And again, the top of the foot. Because again, the other stuff was the tingles, the neuropathy type stuff on the bottom of the foot. And that goes on, and some people also, I've heard that they stop chemo and 3 months later, all of a sudden they start having symptoms again. So, kind of like, okay, this is to pay attention, keep an eye on, if it's just there, if it goes away, if it gets worse, figure it out. But that's about that. Like I said, other stuff is all, I feel pretty normal. So that is really good. Saturday, I visited my mom for, our usual every other Saturday visit that I'm up for. Got some food from Panera, put it that way. So I had a little half sandwich that I had a little celebration, a little bit of, the IV chemo was done. So that was nice. Sunday, yesterday, it was very nice. We put on schedule that my daughter's boyfriend's mom has been trying to get together with us because, they've been dating since July. Hey, it's been a year. August? We're almost into August? Yeah, I think it's been about a year that they've been dating. Wow. Time flies. In any case, I don't know, right after either chemo started or around that, I know she kind of wanted to try to get together with, with us to just kind of meet us and see, get to know us a little bit better and stuff, and we get to know her and everything. So very nice, very sweet. We've tried a couple different times, and she's like, okay, I know your mom's not feeling well, but let me know, whatever. We tried for Mother's Day, but that was on a weekend of my chemo, like treatment type stuff, so I wasn't up for it that day. But then she came over and nicely brought us food. And so we got to meet her that day, and that was, talked for 5 minutes. So I met her and her son, her other son. And so finally I said, okay, right now for this, I know this is my good weekend. And if she's available, because she put out to Mandy again on Thursday or something that she'd like to get together. And so I told Mandy, I'm like, well, okay, I'm good for Sunday. I said, so if everybody's available for Sunday, then, that would work. And so she checked, and yep, that all worked. And so this past Sunday we went to Flipside and had a lunch there. It's like a noonish lunch. And that was very nice. Got to do a lot of talking and, eating. And then asked if I wanted to come back to the house. She's like, it depends on you, how you're feeling, and all that. But if you're up for it, she was, I would love to have you back to the, to the house and talk some more. And I'm like, okay, that was fine with me. I was still feeling okay. I have had rectum pain still for the last couple of days, even though I'm doing the Advil. Trying to keep up on that. I know there's still, days or even before this where I was kind of letting it go an hour or two past when I was kind of due for it. Again, because I'm not really having pain per se, but I always forget that week, kind of the week after chemo is done, then for a few days I have rectum pain, which I'd asked the doctor about, and he said, well, yep, that's the chemo doing its job, so hopefully it's taking care of that tumor. And I'm like, okay. So that's where I'm at with that. Otherwise I feel good. But I thought, yeah, I could still do that, and very nice. And so went out to her house, so beautiful. She has so many flowers. I guess she sits on, her house is sitting on 5-acre lot, so they nicely have a swimming pool and very nice back porch area, and And then then a lot of just greenery in that to the back, which are going to be beautiful to look at. And she says, yeah, I asked about fall, if there's a lot of colors, and she says, oh yeah, the different type of trees, and it's just beautiful. And in the front, there's a whole lot of more trees, and then a lot of flowers. So then she's like pretty much always working on her yard, always remodeling and making it better, and trying to eliminate more of the grass and put more flowers in, so there's less mowing time, which is smart. So again, it was beautiful. We had a good time. We sat on that back porch area. She had some sunshade covers that go over the top, and beautiful weather. It was just perfect temperature, and sat out there and just drank some water and talked for a couple more hours. I was surprised. Thought we'd go a little bit. At one point I was kind of almost ready to go, but then the girls and the boys. So we also had, Jack was also there, the other son, and they have a cat that's indoor outdoor. They always make sure that the cat's in at nighttime and stuff, but during the day it's pretty much outside wandering around. And when we first got there, it was back on the back sidewalk, and so they were petting it, and it was okay. And then it kind of started wandering. And then we were walking around the yard to see all of her stuff, and the kitty was walking with us. I'm like, oh, okay, that's sweet. Oh, take us on a tour too. What's your favorite part? So that was nice. So we got to see all that. And so then after a while of sitting and talking, the kids kind of were like, oh, had enough of it. They want to go find Kitty again. So they got up and wandered off and found Kitty in the front yard and brought her back. Poor Kitty. And kept patting her, and whatever. She would jump off and kind of try to get away. But it was cute. It was very nice. So they enjoyed a little animal fix. So again, it was a very good visit. It was very happy. I don't know, Wayne was happy with it, thought everything went well. Cassie thought everything went well. Haven't had a chance to ask Mandy much if she was okay with it, but it seemed that all went well. So again, that was very nice. So for right now, I have this whole week off. Woo! So we'll see what I can get done while I have energy, how things go. Slow but sure, day by day, kind of, like I said, do what I can. And then on Friday, I'm going to have dinner with one of my friends, Stephanie. She's been on this channel before. So I haven't seen her in a long time. We text here and there and stuff, but she's also usually pretty busy with her activities and hobbies on the weekends and stuff. So it's very nice that we'll be able to get together and talk. And while I'm feeling well, maybe I'll feel well that whole first week through, the first week of radiation and stuff too. That'll be nice. So feel okay. So then there's today. Today again, yeah, so far okay. Took me a long time typing up the notes, so it's like, I want to get to the video. So my one thing that I really wanted to get to do today was do my video and then edit it and put it up, knowing it's going to be a nice long video. That's it. So what else? Other real life stuff. I've talked before about how, because the large intestine is still alive and it produces mucus, that every once in a while you have pressure in the butt, like you have to poop and mucus comes out. Well, I've had that for the last 2 weeks now, every day. I'm like, can we go back to the beginning where it was like once every 2 weeks? Because with that too, it also is on and off. Sometimes I have a little, I'm sitting at the computer or doing it, and I have a little butt pressure, and I'm like, oh, okay, let's go to the bathroom. And I stand up, and while I'm walking there, I'm like, it goes away. And I'm like, well, okay, do I have to go to the bathroom or not? I don't know. I'm like, well, I'll just go sit anyways. And then sometimes something happens, sometimes something doesn't. And then there are other times where, same, I'll have a little bit, I'm like, stand up, and I'm like, oh, I really gotta go, gotta hurry up and get to the bathroom. And again, I haven't had any accidents or anything, thank goodness. But yeah, but then I have the mucus come out. I'm like, okay, I appreciate that you're staying alive and you really want to be part of all this, but you got some time, honey. Can we just, let's slow down, let's lay off a little bit, please. So I don't know if that also is leading also to the rectum pain. It doesn't hurt when I go, it doesn't hurt when I wipe, but like within an hour later or something, then I start feeling rectum pain. So I haven't totally figured that one out yet, but that would make sense because, again, for 2 weeks now I've been having that happen, and it's a little bit past of, in fact, this may even happen around my chemo day, which, again, like I said, usually I get a week of being okay or whatever, and then I'll have some pain, which still being affected by, being okay with Advil. So I'm okay with that. That's, if I have to go up on pain med, I do, but for right now I'm doing all right with that. That's it. So I have filled out my next calendar. As I said, I have my first treatment starting on the 31st, and then boom, there's August. My August is full. So every day in August, and then I actually go through like September 7th. So once again, I'll be happy to be putting the X's through these days, marking it off, and getting to the end of this journey, step by step. So we're going to be in step 2, phase 2, and that's all right. It's kind of funny thing. That's how the doctor had put it on his little notes of step 1, step 2. Yep, step 1, step 2, step 3. So slowly but surely, day by day. Again, I appreciate all of you. I appreciate all of your prayers. I appreciate you following me through this journey and helping me through this journey. I appreciate your comments. I read all of those comments and respond to all of them. They are coming from all over the world, so that is super nice. I appreciate that very much. Thank you. I do that in my nightly prayers when I pray for all the people that I know, like I said, and then I kind of go across the United States with the different people that I know and where they live, and my relatives and YouTubers that I follow, and I'll pray for everybody. And kind of, bring up. Then I go over to like the United Kingdom, England, and some people there, and pray for all the people and stuff that's going on over there, in South Korea, and then like Australia, and then bring it back to all the YouTubers, and then all my Facebook group, and everybody else, and all the colon support groups, and anybody that needs prayers. But I sit here and then I send out little hearts and prayer, and I cover the world with angels' wings and have the heavens shoot down little love hearts to surround the world in love. Love, healing energy. Let's, anybody that needs it. The hospitals, the first responders, I pray for all that. So keep light and love in the world as much as I can. That's part of my job, is to be one of those little sparks of light. So I'm gonna cry. So I appreciate, the prayers, keeping me healthy, keeping me getting through this with the minimum side effects, all that good stuff, because, I love being here. I want to be here for many more years, so thank you. On that note, you guys, keep it positive. Go make it a great day. Bye-bye. I thought I would cry more during the whole, talking about the sip and I had to drink the fluid part, which when I was writing the notes, I started crying even during that. I'm like, let's see if I can get through the video without crying. Yeah. I appreciate you.